Every year, over 55,000 Australians have a heart attack, equating to one person every 10 minutes. 3 in 4 of these patients survive and have to manage their condition. But it's not just the physical recovery that is difficult. Emotional recovery is also a big issue for patients. I'm here with Dr. Barbara Murphy, the Director of Research at the Heart Research Centre in Melbourne, to talk about the cardiac blues. Dr. Murphy, can you tell me a little bit about what happens emotionally for patients when they leave hospital after a cardiac event?
So after the cardiac event, patients leave hospital. They're very well managed physically, but the cardiac event isn't just a physical experience, it's an emotional one as well. And patients do tend to go on an emotional roller coaster. When they leave hospital, when they get home, they go through a range of emotions.
Right, so what happens for patients emotionally? What is this emotional roller coaster?
So it can vary. It differs for each patient, really. Some patients get really sad and down in the dumps and they cry really easily and become very tearful. Some can also get really quite angry and irritated and frustrated. They might find themselves snapping when they've never been a snappy person before and getting annoyed and angry with people around them. We also see that patients show a range of sort of behaviours that are different. They might stop enjoying things that they've previously enjoyed, and they might withdraw from family and friends. They mightn't feel like socialising or just doing normal things that they've previously done. They tend to worry a lot as well, worry about whether they'll have another heart attack, whether they'll get back to work or get back to doing normal things, just, whether they'll ever get back to their normal old self.
Right. So is this emotional roller coaster, is this normal?
Well, it is. We find that although patients are not often sort of told about what might happen for them emotionally, we do see that really almost all patients experience some of these emotions, and some go on all of these emotions and all the emotional roller coaster. But almost no patient is immune from experiencing some emotional response after their heart attack or heart surgery.
Right. So how long could this roller coaster go on for?
Well, we tend to see that it can start really early on, right from day one, or it might start a little bit after patients leave hospital, and it can go on for anything up to 6 weeks or even 2 months. So we typically see that the symptoms do start to resolve at about the 6-week mark, and by the 2-month mark we do tend to know whether someone's sort of on the improve or whether they're really getting worse emotionally.
All right. So that 2-month mark could indicate that someone might be depressed.
It does seem to be that way, yeah. We seem to know that those who have that early distress, if it really is the cardiac blues, which we're not as worried about, we just want to support patients through that normal process. If it is the cardiac blues, we will tend to see the symptoms resolve by about the 2-month mark. But if someone's still distressed at the 2-month mark after their cardiac event, then it is possible that they are now experiencing depression and they do need further help.
So is it possible to identify patients who might be at risk of depression at the time that they're actually leaving hospital?
It is actually. There are what we call some red flags that can alert us to patients who might be at more risk of becoming depressed later on when they get home, and there's a couple of key ones. Firstly, if a patient's had anxiety or depression in the past, then they're at much greater risk of being depressed after their heart event. So that is a key factor. If we can simply know patients' mental health history, then that puts us well placed to know if someone might get depressed again this time. As well, we find that patients who live alone or are otherwise socially isolated are also at increased risk. And there are some other things like the younger patients, those under 55, tend to be at greater risk of becoming depressed. We see about 1 in 4 or even higher rates of depression amongst those young patients. Also, there's other factors like having comorbid conditions, like having diabetes as well, and then other things like being a smoker. These are all factors that make us be a bit more concerned that someone might be at risk of becoming depressed.
And so we've looked at how many people may develop depression after a heart event. How does the depression differ from the normal distress that you'll see in most patients after a cardio event?
Okay, so what we see in most patients, that almost all patients experience, is this roller coaster of emotions, which when you think about it is pretty normal to think that that would happen after someone's gone through a life-threatening incident in their life. And we see that about 80% of patients that will resolve. So we see about 1 in 5 patients who do become depressed after the cardiac event. And depression really is different from that normal distress that we see. Depression involves profound sadness that's been going on for some time and the person experiences most of the day. And it goes hand in hand with really a disengagement from normal activities in life. But the feelings are much more profound and sustained.
So can you tell me about the Cardiac Blues project and the resources that you've developed at the Heart Research Centre?
Yes, well, in the last 12 months, with support from Beyond Blue, we've developed a suite of resources that are for health professionals and patients, and they're really to help inform patients about the cardiac blues. So whilst we do touch on depression in our resources, what we're really wanting to do is equip patients with just some knowledge of what to expect emotionally when they get home from hospital, so that when these things happen, they're not so shocked and they're a little bit better able to handle it when it does come up. And in the resources, we also explain to patients what it is that might help them indicate that they now are at risk of depression. So we try to differentiate between the normal distress and the depression that we see in patients. So it's been terrific. We've had a wonderful response from health professionals and patients. We've got posters and pamphlets for patients, and we've got a guide for health professionals to help them use the resources with their patients. And also we've developed some online training for health professionals to use as well.
Could you tell us something about the launch in July and how widespread it's been?
Yes, we've launched the resources to basically all the hospitals across Australia now. So all the cardiac rehab programs across Australia, all the coronary care units and the cardiothoracic units in the hospitals. And also we're following up with Medicare locals to work towards having the resources picked up in general practice as well. So we're hoping that at each port of call in the patient's journey after their heart event, they'll be able to access these resources, both the written resources and in conversation with their health professionals.
Well, thank you very much for that. Is there anything else you'd like to tell us about it?
No, thank you very much for asking the questions.